Hello, India, and welcome. My name's Emmanuel, and this is Dr. Tony SURACE, and we are from Australia and Dental Evolution. Welcome.
Hello, India. Lovely to be speaking with you.
This is a fantastic idea today, chatting and talking to the Indian dentists. This is a great forum, and thank you. We're honored to be invited to your organization, which is the World Dental Association. It's fantastic. You've got a lot of participants. So we're here to give you a really good presentation on the topic is the 4 stages of recovery. And so, Tony, what does that encompass?
Okay, thank you, Emmanuel. So the 4 stages of recovery from COVID-19. So Emmanuel and myself are very involved in practice management in Australia, and we would love to share with you all a few of the tips and techniques that we're using with our clients in Australia that has helped them through the stages that you are currently going through at the moment. In Australia, we've been lucky. We haven't had too many cases of COVID. We have actually been able to go back and see our patients already. So we are now practicing nearly back to normal. So I believe that Emmanuel and I have a lot of insight to share with you all about what it takes to get your business back up and running after everything goes back to normal, as they say. So we have a slideshow to share with you. We want to give you maximum value. Okay, so the way that we can do that is if you participate. So please ask us questions. We have a wealth of knowledge that we are able to share with you, not just from Australia, but from America and from the UK and from Europe. We have a lot of knowledge that we will be able to bring to you to help you recover from this challenging situation.
Yes, well said, Tony. We have a big network around the world, so we have our eyes and ears on the ground listening to what's happening to all dental practices around the world and how they're unfolding and how they're handling the situation. So as Tony mentioned, we have gone through aspects of this in Australia. It has been very difficult for all of us, for our economy, for the patients and for the practices, and especially for the dentists and their staff. And we're sort of getting on board, not at full capacity, but we are getting on board. And I understand that India is still in many of the states still locked down. And so what we're going to explain today is a little bit of the emotional aspect of this. We need to talk about the emotional aspect, Tony. A lot of dentists are really feeling hurt by this situation. And, how are they feeling? They're stressed, and they're stressed about their family, their practice, their patients, and their staff. There's a lot happening here. So we need to address this issue a little bit. And we're also going to talk about a couple of strategies that you could start implementing to really try and recover as quick as possible when your practice comes back online, which I understand in some states is not very far at all. It's probably at the end of this month. So let's start, Tony.
Excellent. Thank you, Emmanuel. Looking forward to sharing.
Now, by the way, I just want to mention it before we start that if anyone would like to go to where we do a lot of this material, we're also on a Facebook forum, and it's called Dental Evolution. So there it is. Join there. There's a lot of good resource materials there for you. So,
could I just let you know that I can't see the slideshow?
Yeah, sorry. I'm just fumbling around a little bit. Here you go. All right, let me just see. It'll come online in a minute. Come on, share. There you go. All right.
That's better. Fantastic. So that's the link to our Facebook group, Dental Evolution. And we'd like to, Emmanuel and I have a philosophy of sharing what we know. So we believe that we can help our dental profession by sharing the tips and techniques that we have gained over our last 20 years each in the business of dentistry. So myself, I am a general practice dentist in Melbourne, Australia. I graduated 25 years ago, and I own a practice management company called Momentum Management, and we educate dentists to be more business-minded than just clinical-minded, okay? So we help teach you the business of dentistry, and I'm sure many of you know the great Emmanuel Recupero. Emmanuel, would you like to introduce yourself?
Yeah, I'm the managing director and founder of a company called Dental Ed. Some of you have done courses in India with us. And my background is about 20 years of dental education and really having eyes and ears on the ground about strategic marketing and business development. So we bring in both experiences, very well harnessed, shall I say, and really blend it in to deliver it in a nice way that you can understand what we're trying to do. So we come with different experiences as well as world knowledge, and you are working with one of the best. So I would say, well, it's pretty hard to say that there's two people with as much experience as we have. So let's go ahead. Okay.
Wonderful. So there's one thing I'd just like to say before we start as well, is this is not meant to be a typical lecture that you get from a presenter and that, you know, you are just presented material. We have actually written this material so that you can ask us questions, okay? So please do, and that will get the most value out of this session for you. So just you'll be able to chat, pop comments in the little chat bar, and we will read them out and we will answer your questions as we go along, as many of them as we can anyway. So thank you, Emmanuel.
Okay, so 4 stages of recovery. Toni, let's start with what they are or what we're going to talk about.
All right. Well, we'll get into the actual stages, the 4 stages, a little bit later on. But first of all, I would like to let you all know that I have a background in psychology. So before I studied to be a dentist, I actually did a science degree and my major was psychology. So I bring a lot of psychological background into what I do in a dental practice. And I teach people to communicate using emotions and sharing emotions, because that is something that we feel that we possibly were not educated well enough in our dental education about these aspects of life. So what I really want to do is set up the stage for you today and let you know that this session is about sharing. It's about sharing experiences. So we'd like to share our experiences with you. We'd like you to share your experiences with us. We have a number of strategies that we can help you, from helping you personally to grow and develop, to helping your team, so your staff that work for you, to grow and develop and build your business, and also, of course, business strategies, marketing strategies that we can talk about to help get you through this situation that we're currently in. And together we call that evolving. So we believe that if you are not evolving, if you are not growing, you're going to be stagnant. And being stagnant is really not an option in today's dental world. The dental world is evolving so much with clinical techniques and materials. We also need to start developing our communication skills and also our business strategies to make sure that we keep up. So just letting you know, giving you a full picture of how we like to help people and what we're going to deliver to you today in this session. Thank you.
And ironically, my background before I started my business and my company, I was a microbiologist. So I have some ideas about viruses, and it's kind of a good mix for right timing for today's presentation.
Definitely. All right. So we totally understand that everyone around the world is feeling very uncertain, that, you know, we're not sure of what the future holds for us all. And the fact that things are changing constantly, it does make us feel quite uncertain. Some of us are feeling really overwhelmed by the information that we're getting, overwhelmed by too many webinars. If you're anything like us people in Australia, we've got people saying, no more webinars, we've had enough. But it's been wonderful having all of the webinars, but overwhelmed by the things that you could possibly do, all of the things that you should be doing. And it's really hard to decipher what direction to take. So this makes us stressed. So we're stressed about our businesses. We're stressed about our families. We're stressed about our patients. We're stressed about so many things. And this is not just, you know, a local situation. This is happening around the world. So we really want to talk about this stress and how we can deal with this stress rather than keeping it all bottled up inside, because that's not a good situation to be in.
I agree, Tony. It isn't a good situation to be in. I think the good thing is that, well, I don't know if it's a good thing, but to feel a sense of comfort, there are lots of people who are going through this at the moment. So you're not the only one. There are lots and lots of people and lots of dentists that are going through this as well in every part of the world.
Definitely. Okay, so what I would like to describe is what you might be going through at the moment, or you may have passed through some of these phases already. But what I want you all to understand is that these phases that you're going through emotionally and psychologically are very much like the 7 stages of grief. So in effect, we have actually lost our businesses as we knew them. So we are feeling a sense of grief. And what I want to say about these stages is it's very normal for you to go through each stage. And it's very normal for everybody to take a different amount of time to go through these stages. So let's talk about the stages. So at first, I believe that we all were in shock. And along with that shock came a little bit of denial. You know, there was a disbelief that this couldn't be happening to us. There was a, oh, it'll be okay, and let's just keep doing our business for as long as we can. And I thought that things would return to normal. So let's just keep going and life goes on. Now, I believe that most of us have moved from that shock and denial stage now into what we call the anger and depression stage. Emmanuel, would you like to go through that stage?
Well, the anger and depression stage is where you feel bitter and resentful. You're asking yourself perhaps why this is happening. There's a sense of guilt and blaming and loss of faith. I guess this is all bottling up to a point where you actually are, you know, feeling angry about the environment, the government, you know, who started the virus. So there's an outlet of anger as to how you're channeling this. Tony?
And I would say that we absolutely saw this with the dentists that we're working with around the world. Everyone could fit themselves somewhere into this scheme. And as I said, there's no set time period for each person. It's a personal journey. And it's a journey that I believe that you need to recognize is happening for you, and you need to allow it to happen. So if you're still feeling angry and you're feeling a little bit depressed, you know what, it's okay. And it's really good to talk about it. So I'd actually really like to be asking you now to maybe pop some questions in the chat bar if you can, or let us know which stage you might feel you might be going through at the moment so we can talk a bit more about it. The next stage after anger and depression is a release and an honoring of what's going on. So there becomes an emotional release where you then start recognizing that, yep, this has happened. Now I need to get on with it. And what can I do to get on with it? So it's a more rationalization phase. And I would say that a lot of you are in this rationalization phase that, look, we're all in the same boat and we just need to get on with it, and that you have to make peace with what's happening and get yourselves organized so that you are ready to, work through the next stages that are coming through. So after that, look, we believe that the thing that will happen is that you will end up growing and loving your business again, okay? You will end up returning to dentistry, and dentistry will be a bit different. It's not going to be the same as it was pre-COVID, but post-COVID dentistry, learning to love it again will happen, and we've just got to learn to get used to the new kind of normal. And that's what we're trying to do in Australia at the moment. And that new kind of normal is, you know, involving things like, you know, having more structured procedures in place for screening patients before they come to dentistry, have dentistry completed, coming in and having a more uniform, organised way of how they move through the practice. We'll talk about a lot of these strategies a little bit later on. So thank you.
The 4 stages of recovery, Toni.
Yes, okay. So the slides we've been talking about have really just been setting the scene for our major topic for today, which is the 4 stages of recovery. And Emmanuel and myself believe that there are these 4 stages that we've popped up on the slide here. Number 1 is the survive. So really, we just need to work out how to help our business survive this time. Number 2 is we need to prepare. And we need to prepare for business not being the same, but we also need to prepare for business being different in a number of different areas. And here, I believe, and I know Emmanuel believes strongly as well, is you need to prepare to be more of a business person, not just a dentist anymore now. It's very important that we start putting on what we call the business hat, and then when we need to be a business person, and taking it off and putting on the dentist hat when we need to be a dentist. Okay.
Correct.
Stage 3 is reviving your business. So, you know, the doors have been closed, and what are we going to do? We have to give our business a bit of CPR to get it going again, okay? And we're going to talk about some techniques to do that CPR and get the blood pumping in the business again. And then we're going to talk about how you need to consider evolving your business and maybe changing your thoughts a little bit so that you can move your business in the direction of the times along with COVID-19 and what happens after.
No, totally agree.
Excellent.
Totally agree. Yeah.
Okay, so now they were the 4 topics. Now we're going to talk about survival. So survival is what you are in at the moment. And I very strongly believe in these 4 areas that you need to be working on during survival. So you need to be preparing your team. You need to be preparing yourself. You need to be looking at your cash flow, both your business cash flow and your personal cash flow. And you need to be contacting your patients and keeping the communication channels open with your patients. Now, I know that some of you will be sitting there and going, that's okay, in Australia, you can do that. That's okay, in America, they can do that. We don't do that in India. That's not what we're like. I don't believe that's true. And I can tell you from experience that the techniques and the strategies that we use in Australia, in America, and in England work in every single country around the world. We just need to tweak them a little bit to make them a bit more yours, okay? And which is very, very easy to do. So please make sure that you shake away that disbelief that's sitting there on your shoulder at the moment, because I'm sure that some of you are feeling this isn't relevant. It is 100% relevant. And if you want to be in the top 5% of great dental businesses in India, these are the types of things that you need to be looking at and the mindset that you need to have to get you there. Emmanuel?
Toni, I believe that with the economic environment that every dentist is exposed to right now, as well as, you know, at least for 2 years, I don't think that the virus situation is going to go away in a month or two. And, when you open up and everything starts getting back to normal, this from past history, which is what we have here from the 1918 virus epidemic, or pandemic, which is closely related to the way this virus is, its pattern and infectious ability, is that we're going to see this thing happening or continuing in the environment for at least 18 months, over 2 years or thereabouts. And so because we don't have a crystal ball as to see when this is going to finish, until we actually have a vaccine, I think that's when it's going to finish. But at the moment, vaccines are probably a year or two away. So this is going to stay with us. So we have to really look at our business and see how we're going to adapt it and modify it to survive this whole pandemic process and be viable to come out fully functional once this pandemic leaves the environment. So to assume that this is going to go away and we're going to be okay, and as soon as we open doors, the patients are going to flood in and they're going to keep busy, everything's going to be the same, is not, I don't think, a realistic picture. I think things are going to be slightly different. Just because you open up your practice, for example, in a month, doesn't mean that patients can actually come and see you. You have to consider that patients are still scared to travel. There'll be still restrictions on public transport. This thing will keep lingering on. So you have to look at the whole perspective in a big picture as perhaps how things are going to pan out. And so what Tony's talking about here is you really need preparation, and really understand how to manage your business in this moving environment that's really unpredictable at the moment.
Thank you, Emmanuel. Really well said. I would like to say hello to a few people who've been saying hello and good morning. So some lovely names here. Ramonette and Amit and Pranab and Lalbabu and Litsa. Good morning. Thank you for saying hello. Prabal, thank you very much. Okay. Now, thank you, Emmanuel, if you wouldn't mind, if you just leave that right up there. Thank you. I'd like to, no, back to the other one. I'd like to explain my slide just a little bit more here. I'd love to see if you could pop in the chat button for me. Is anyone, just a yes or a no, who is preparing their team? Who is working with their staff, even though your staff are at home, and you're paying them still, because I know that that's what a lot of you are still doing? Who is getting their staff to do some jobs for you, or training them, getting them to do things? Yeses or nos? Can we have a little look in the chat line? Let's make this interactive.
So yes, as far as we know that your staff are still being paid while they're at home, because there is this concern that they move on to other dentists, and finding good staff in your environment's difficult. So I understand that you're still paying them even though your practice is shut. So we're thinking, well, if your staff are working, not working, you're still paying them, what are you doing with them while they're in lockdown? So that's what we're really trying to find out here.
That's what we're referring to, because in Australia, yes, we were paying our staff as well. But we thought that if we were paying our staff, why not use this opportunity to train them and help them get to the next level, so that when we come back to the clinic and we open the clinic, that they would already have some skills that they could then bring into the clinic. Now, I also believe that you can ask your staff, you don't necessarily have to pay them to ask them if they would like to be trained. If you have good communication with your staff and your staff are interested in building the business for you, which will also then help them keep their jobs, then maybe you could consider looking at getting your team to watch some webinars, just like you are at the moment. But maybe not necessarily clinical webinars, maybe something with communication and helping build the team, so that we can build the business later on. So that's just something that I wanted to mention to you, and later on we'll tell you about some resources that you could use if you are interested in that. Now, Yep.
Let me paint a picture here. Sorry, Tony. Let me paint a picture. If the environment is potentially going to change, so is the business. It needs to change and it needs to perform a little bit different. It may be that, there may not be as many patients. So you need to implement better communication skills with the patients that are out there. Are your staff being trained for these new changes that are taking place that potentially will be in your business? So that's what we're addressing here is, don't, you've got downtime at the moment. This is a great opportunity to have staff train, look at things and research things, do your collaboration on Zoom and communicate, what your strategy will be, train in those areas and just build up the level of from your staff in terms of communication ability as well with your new business model that you're preparing for.
And I think that customer service skills is going to be absolutely critical moving forwards. Okay. So how do you distinguish your business from the business down the road or the business that is a stone's throw away from your business, which I hear there is a lot of competition? The way you're going to differentiate is by providing a better service for your patients. So I believe that you can prepare your team, but you can also prepare yourself. So just like you're preparing yourself by watching lots of clinical webinars, what are you doing to prepare yourself to be a better leader, to communicate better, to running your business better? This is part of your survival. The better leaders and the people that understand their businesses really easily are going to be the ones that are going to see things before they happen and are going to be able to jump in and be able to hold on to their business for longer than those that don't prepare in this survival stage. So can I ask who's been watching CPD, clinical education? Let's get some yeses from you, okay? Who's been doing clinical education?
Bet you lots of people have been doing clinical education.
I'm going to come back to this in a moment while, watching lots of webinars I'm getting. Okay. All right. So now who's been preparing themselves? Yeses or noes? Yeses or noes, please. And while I'm waiting...
Preparing themselves as
a leader and a business owner. Now, what I'm going to talk about while I'm waiting for those answers to come through, Litza, fantastic, that's excellent, is I'm going to talk about cash flow. And this is something that is absolutely crucial. If you want to make sure that your business is going to survive, preparing mentally. Swapnil, fantastic, excellent. I love that, preparing mentally. Now it's time to take it to the next step and start preparing with skills to help you be a better leader. Cash flow, coming back to cash flow. We need to know the numbers in our business, and that's what cash flow is all about. So we need to know what's coming in and what's going out. And for a lot of you, it's going to be not much coming in and still the same as always going out. So what we need to do is we need to prepare. We need to have a look at where you can cut costs. We need to have a look at where you can increase your money coming in. And this becomes a great big strategy that you will look at all the time to make sure that you can keep your business afloat. Now, I have a special little gift for you all very soon. Emmanuel is going to put up a link and I'm going to share a spreadsheet for you that will help you with your cash flow. And it's absolutely free and it's our gift to you. Okay. Now, the next thing on this slide that we believe that you should be doing in this survival time is contacting your patients. So don't just contact your patients when you can go back to work and you can see them for dentistry. Why not contact them now? Why not keep the communication channels going with them now? Emmanuel, what would you like to add to that, please?
I think it's important to keep the communication channels going. I mean, patients want to know what's happening with you in your practice. They have a sense of loyalty to the practice, believe it or not. And so having that communication with them is just reassuring them as to when you're going to open up and what you're doing. Assuming that they know is just not right. So patient communication is essential to keeping them emotionally connected to the practice and emotionally connected to you as their dentists.
Absolutely. I'm going to answer a question here from Sushil. So thank you so much for asking this question, extremely pertinent to the situation. Are aerosol-related procedures allowed in Australia after COVID-19? To be perfectly honest with you, no, they weren't to begin with. And we had to work with a very strict regime of screening our patients. And then we were allowed to do some work with rubber dam and high volume evacuation. So that's how we were able to get by. Now, I can understand that you will be concerned that you are not allowed to use aerosol-related procedures, and that's absolutely fine. There are ways of getting around this situation. Absolutely screening your patients really well. Pre-procedural mouth rinses and rubber dam. So for those of you that are not great at rubber dam, that is some CPD that you should be watching at the moment, and make sure that your skills are up to date. And what has happened now is that our dentists were so good in Australia at controlling infection using the methods that I've just spoken about, that we've now just been allowed to go back to using aerosol procedures, and still under strict guidelines of screening our patients. And to be perfectly honest with you, why not? We are the best in, one of the safest places really around if we are using universal precautions. We're screening. We're looking out for, what type of patient we're working with, then aerosols are still safe. So it's something that we have to work through, though. None of us felt like it would be safe to start off with. But when we've seen the science behind what's going on, we've realized that we were able to move back into aerosols. So even if they're taken away from you for a while, use rubber dam, use those sorts of things, but you will probably get back into it quicker than you're expecting. It was quicker than we expected anyway. Okay. Any other questions around that, please? Please make sure you write the questions for us. And I hope that answered your question. Okay. So just briefly, Emmanuel has put up a link to a Google form. And this Google form is for the cash flow spreadsheet that I am more than happy to share with you. And this is going to be something that if you like this cash flow spreadsheet, that we can do some more work around it. If you like, I can help explain it a bit more to you and help you organize your businesses with regards to the money coming in and the money coming out. Nobody expects to be making money or making a profit post-COVID for quite a while. But to keep your businesses open, we need to make sure that we don't go and make any silly expenses on equipment that we don't really need, any, looking at maybe paying more money for resources that we shouldn't be. We need to have it all documented in a blueprint or a map so that we can watch what we're doing with our business. Emmanuel?
Yes, Tony, I want to add something there just in case people are not really understanding what we're saying here, is that at the moment there's this thought, and I'm seeing the questions come through, about negative pressure rooms, equipment, what do we do, how do we charge? We'll address these questions bit by bit as we go through the session. But what Tony is saying here is that before you make unnecessary strategies in purchasing equipment, you really need to have a look at your cash flow and whether you can really afford these things. And then the question is, if you can afford or you can't afford, should you be buying these things? Are they necessary? You need to be putting things into perspective. If you have proper screening for your patients and you have a very stringent protocol and your staff are trained very well to screen as well, then you are minimizing the risks in the practice. And therefore, if you are minimizing the risk, do you need to invest in all these expensive equipment? So that is the question we're asking ourselves here, or asking you to. So we'll go through them, but yes, we don't believe, as we do in Australia, that it is necessary to make huge investments in negative pressure environments and lots of equipment in the situation we're in. We are working a lot better in screening patients and having a better triaging system, and training our staff accordingly, having the right questions, the right protocol, and therefore minimizing the risk of patients coming into the practice. We also have an app that we use here that a lot of people are using in Australia, so that we can see if they've been infected, who's getting it and how we spread. There's been a situation here, I think it was last week, it was presented to us that a patient had their husband who had some symptoms of the flu, and he was being tested. And while he was being tested, the patient was asked not to come in until they get the results from the husband. So that's proper triaging for the practice, which keeps your practice safe, your staff safe, and it minimizes the risk. Remember that in dentistry, there's always elements of risk of infection of some sort of nature. And, this one's another one. And we just have to be smart in how we bring down the risk for the staff. But it doesn't necessarily mean investing in negative pressure rooms is going to reduce the risk, because you still, with these new equipment, if you haven't triaged properly, you can still get infected.
Really well said, Emmanuel. Fantastic. And I 100% agree with what you have said there. I also would like to say that, yes, we've been at this stage in Australia where, as dentists, we were thinking, oh, gee, what are we going to have to buy? How expensive is it going to be? Are we going to have to use, respirators to work on our patients? So these questions that you are asking are absolutely extremely pertinent to the discussion. But what we have found as time has gone on, and we've looked at the science, is that it actually was not necessary. Sushil has made a great comment here, and I'd like to read it out. Has written that, so you suggest rubber dam with high vac suction, along with other protective gears and a good sterilisation protocol, may be a must in post-COVID era treatment at the moment till vaccines come. I'm going to say absolutely, it's a must. And that's what you need to do with your screening. Add some screening onto that as well. Really good, solid screening. And then Sushil has given the comment, I too think it's the most practical approach. And you're absolutely right. It's a practical approach, but it's also based on science, okay? So we have stringent laws in Australia about how we are able to deliver our dental services, and the government would not let us practice if they did not believe this was safe. Australia has some of the best healthcare in the world, and for that reason, we believe that our government knows what they're talking about. So yes, I truly believe that this is a way that you will move through this way. And so please don't concern yourselves too much with how you're going to buy equipment. Negative pressure rooms, yep, we went through a phase where we all thought we needed negative pressure rooms. No, you only need a negative pressure room if you are working with somebody who actually has COVID. And because you are screening really well, you will deny that you will treat that person. Somebody's saying, what exactly do you mean by screening? Yes, temperature check has actually been proven to not be so vital. It's not so important, but definitely travel history, contact history. Yes, when you're asking, is there anything else? Obviously, there's the signs of COVID. So a couple of days before you come down with the full-blown virus, you have a sore throat and a cough. So they are questions that we ask. And we actually even know that there is a gastrointestinal symptom that you can get. So patients can potentially have loose bowels or some diarrhea before they show the signs of the disease as well. So yes, we have a number of questions that we ask. Now, the other thing that we do that makes us very comfortable is when they come into the practice, we obviously we're getting them to use a hand rub, an alcohol hand rub. We are socially isolating them. We're keeping social distance. So we are not letting too many people into our waiting rooms at a time. In Australia, we have a rule of 1.5 meters between each person. I don't know if you're able to do that, but that is something that helps, or get them straight into the clinical room when they enter your practice. And then we give them the pre-procedural mouth rinse. Now, we know that if you're using something that has 1% hydrogen peroxide in it, that will inactivate the disease if there is any virus in their mouth, which then makes the aerosol not so dangerous. So it's common sense, and there's science in this as well. So I'm loving the questions that you're getting. Thank you. Do I advise every patient should undergo a COVID test? No, not at this stage. We don't have testing widespread enough available in our country. We're not doing that. If you have the ability and it's cost effective, then why not? But at this stage, that's not what we're doing.
I love the questions, everyone. And Toni and I find the questions very interesting.
Love it.
I love the questions. But what I see from these questions is that there's a concern of when you open the practice, how you're going to manage patients. But what I would love to do at this stage with Toni is I'd love you to think about what your practice is looking like right at the moment while it's closed, and how it potentially can look like if you are not going back to work at a regular pace and there are not as many patients at the practice. So we really want you to do, your planning around the business and how you're going to get the business kick-started and managed properly and get it going and survive if you are locked down for a couple of months or even 3 months. These questions about how to manage patients is an important thing to look at. But I think right now, in the situation you're in, it's more important to look at how you're going to survive this from a business perspective. Because if you don't have a business, you don't need to worry about all these infection issues that are in the practice.
Exceptional point, Emmanuel, and totally agree with you. If you could move to the next slide, please. Now, I'd also like to say that what we are predicting, and this is economists all around the world, so we don't just have a virus problem, we also have an economy problem. So people are not going to have as much money to spend. So not only are they going to be scared to come to the practice, they can't get on public transport to come to your practice, they're also not going to have the money. Now, they may not have had money to begin with, okay? So what's it going to do if your business now comes down, when you are able to open, now comes down to 50-60% of what you were producing beforehand? How are you going to get your business to survive? How are you going to afford everything to keep going in your business? And are you just going to business to pay your staff? And is that a viable business option? So I think that that's what we're talking about with regards to getting your leadership skills into place, making sure that you are leading your team, that you're leading your patients, and that you are running that business really well. Putting systems in place properly. So things like your telephone calls and how they're answered, things like making sure that you've got your patients on a system where they are coming back for regular preventative care, coming back and having other dental treatment done, not just coming in for an emergency and that's it. The way that we're going to have to build your businesses moving forwards is about getting repeat business, okay? So in the past, you've possibly had the luxury of just dealing with emergency patients coming in, and that kept your books full enough to keep you going in business. That's not going to work moving forwards. Okay. So
well, I think we might have to give him a little bit of a crystal ball experience from Australia. What we've seen that, you know, as soon as some of the practices have opened up, and we're looking here ahead of time of what you may experience in India as well, where the practices were really busy for the first week or so with emergencies, because that were the backlog of patients that were really needing dentistry. And once that subsided, the practices went quiet. So that's what we're starting to experience here. So this continual influx of patients and being busy is not what we're seeing. We saw that it was busy for the first few weeks, and then it just dipped in terms of busyness. So now these practices are really struggling because there's so many gaps in their books. So the business environment of what we're expecting that you will see when you go back in stage one on your business is that you will see an influx of patients, and then it'll die down. And then it's that, have you planned for that dying down is what we're getting at. So not only do we have to plan now strategically and how to keep the business viable and how to prepare it when you open up, is how have you prepared for when it goes down. So that's what we're going to go through today, is how to really kickstart that business, how to keep it going longer and having a better chance than everybody else. Now, I know that in India, you have a lot of people. I know that. There's a lot of people in India, a lot more than Australia. In our country, the whole of our country is one of your city's population. But you also have equally a lot of dentists, probably about, I'd say, 15 to 20 times more than Australia. So there's a lot of competition. So imagine if the population of dentistry of the patients had less money to spend on cosmetic work, and there are less patients coming in for emergencies, and there's the same kind of number of dentists, then many dental practices are going to feel it. So that's what we're talking about here, is to sort of get prepared for all this.
And Emmanuel is completely correct. And this is coming from our experience of what's happened in Australia, and also in the countries that have not had as big a shutdown as you have in India. So you need to learn from what's happened in other countries, and we need to get those business strategies into place. So this is what you need to prepare for, and that's what we're trying to get across to you here now. Does anyone have any questions about the business strategies, cash flow, those sorts of things that we're talking about? Emmanuel, next slide, please.
Sure.
Okay, so when we do come back, and this is what Emmanuel has just spoken about, is we need to prepare for what we call a new dental world. We know that it's not going to be the same as it was pre-COVID. Some patients will be really scared about their safety. Some will have little money to spend, but we still don't 100% know about that flood of patients that we predicted when we initially reopen. There will be a flood of patients to start off with, but then it dies down. I've got a question here from Ashwini saying, is it going to be normal again as we used to be before? No, it's going to be a new type of normal. And that new type of normal is going to be slower. We're not going to be able to see so many patients a day. We need to slow down. We need to look at our infection control more. We can't be as quick as we used to be. This is going to slow the business down, and like Emmanuel said, this is going to affect our cash that comes into the business. Rohit asked a question. Yes, sorry, Manuel.
Sorry, I think the question also may allude to, will it ever be normal again? Yes, it will one day be normal again, but there's a bit of a long recovery period. You've got to look at the world complete as to what's happening and tie in the economy as well with your business. And there's a lot of people out of work. A lot of businesses have been damaged. In Australia, our economy has virtually been destroyed, and America's going through it at the moment. So we're all trying to maintain our economy with a balance of keeping the virus at bay. So there is going to be a long recovery period. There will be perhaps a depression after this. and then it'll bounce back. But I think the ramifications of this virus will be around for a few years.
Predictions are 18 months to 2 years for the ramifications and the not so normal phase. Look, there is a lot of questions around how do we manage the charges. So Rohit, thank you for that question. I know a few other people mentioned that earlier. A simple answer, Rohit, do your cash flow, have a look at the effect of what's going to happen to your business if you are running at 50 to 60% of your usual production, and then you can have a look at what you might need to increase your charges on. Obviously, the higher you put your charges, the less accessible you're going to be to your patients. So we don't really want to pass on charges unless we have to. But you need to understand your business before you make those decisions. You can't just say everybody needs to put their prices up. That's not how a business person thinks. So that's what we're trying to teach you today, is to teach you to become dentalpreneurs, okay? So that's what that is it's a business entrepreneur and a dentist stuck together, dentalpreneurs. And we want you to start learning how to run your business, not just make decisions off the cuff. But thank you for asking the question. Emmanuel?
Yep. Let's continue.
Yes.
That one.
Okay. So what now? We need to evolve. So we need to look at new business options. So things like, can we increase our prices, or do we need to bring in some new services that might be better for our patients? Something that I absolutely love is video consults, which Emmanuel is going to talk to you about in a moment. There is something where in recession, what happens is often some people want to make themselves feel a little bit better and have a really cheap alternative to some whitening could potentially be something that would be really good for your patients during this time, post COVID, okay? Because people are going to be looking at things to just make themselves feel a little bit better. They can't afford to go on holidays and buy, big luxury TVs and things like that used to make them feel better. Now they might want something just as simple as some whitening. And we've got lots of information we can give you on how to strategize and how to create a business plan around whitening. And we know that this is a phenomenon because in all recessions, the sale of lipsticks goes up, okay? So we know that people are looking for quick fixes. Instead of it being lipsticks this time, how about we make a movement to make it whitening? That would be fantastic. Obviously, we need to evolve our marketing, and we need to have a adapting, evolving, and thriving mindset. So not just looking at how do we put our prices up. It's how do we adapt, how do we evolve, and how do we thrive. That's what I would really like you to understand, is that mindset is going to move you forward more than others.
Okay. So we can take some questions. Tony, can you read that out? I don't have my specs with me.
What was that? Sorry. Yeah, we've dealt with that.
Okay. All right then. So what Tony and I want to talk about now is some strategies on how you can rebuild or prepare the practice for when your clinic opens up. So what are the strategies you should undertake in terms of keeping those patient numbers and getting a little bit more of the patient numbers as soon as you open up and keeping that constant, okay? In encompassing, obviously, in the environment you're in, which is the COVID-19 virus. It is, this virus is going to be around until, like I said, we got a vaccine. And in some countries, it'll be around longer than others. In our country, we have low numbers, but, we have this phenomena called the first wave and second wave. So what we've done is we've dealt very well with the first wave, but from past history, we know that there's potentially a second wave, which is going to be much harder and stronger than the first one. So you may even experience this in India. And if you do, how does this impact the business? So these are some of the strategies that will kind of buffer you from some of these environmental changes. And that's what we're going to talk about, what actions you probably need to undertake to protect your business. Remember, what we're focusing here is everything that protects the business, which then protects you and then protects the patients and protects the staff. If you don't have the business, then you don't have any of that cascading sort of, people that connect to the practice. You won't be able to support them. So it is essential and pertinent to really protect the business. And so it's important that you do your cash flow. You know how much money you have to sustain it while it's closed, sustain it while it's open and it's not, thriving at its full potential. If it goes down a little bit, that you have enough cash flow to make it keep working. If there's another level 2, a second wave and things shut down a little bit again, do you have enough to keep going? A lot of business here in Australia have gone. They have failed completely. So they're gone. There's lots of businesses that have shut down. So it's realistic that it also can happen with a dental practice. And so we're not all immune to it. Okay, so this is what we think you need to do in terms of your strategy when it comes to marketing and building the practice. I think that, and Tony, by all means, interject, is that you should really focus on your database. In other words, you need to focus and preserve the patient base that you have in your practice. Okay, I'm only going to really focus on those practices that have got a patient base, and that is that they've got a big patient base. The bigger, the better. So the first thing is you need to protect the business. You need to protect the database. You need to protect the patients in that practice. So that is where you need to focus when it comes to your marketing. You don't need to go and start going online and doing cosmetic and implant and promoting that. This is not the right environment for it. It's not the right mindset that people have that are looking for dentistry at the moment. What you really need to do is you need to protect your clients in your practice, and you need to keep them engaged with your practice and get them to come back in for more dentistry when they need it, right? So,
Emmanuel, can I clarify what you mean by protect? So what we mean by protect is make sure that when they do need to come back to a dentist, they choose you and not the practice down the road. Okay, so the way that we are helping practices protect their patients and keep them coming back to their own practices is by nurturing them and showing them that we care. Okay, so things like connecting with your database. Now, that might be an SMS, okay, a really well-worded SMS letting them know that, what's going on at the moment. Or it might be something which we've been doing in Australia, is we record a video of the dentist. The dentist speaks for 60 seconds, 30 seconds and says what's going on, and that, we're hoping that our patients are really well and that we're ready to look after them again when we reopen. We'll let them know. And that gets SMS'd out to our whole database. What Emmanuel means by database is the patients that have visited you before, that have given you either their email addresses or their telephone numbers. So I know most of you will be SMSing or messaging your patients with confirmations of appointments and things like that. So it's a very similar strategy as confirming an appointment, except we send a video and we are showing that we care about them. Something wonderful to say to your patients is talking about how important it is that they have a healthy immune system at the moment, and that if they have bad teeth, that their immune system will not be as strong and they won't be able to fight off the virus as easily. Now, something like that is going to show that you care and also help the patients come back to you when you can reopen, because they're going to want to be more healthy. So that's one of the strategies that you could potentially use.
Okay, so there are potentially two ways of looking at this. One is to do external marketing, advertising and all that. That's not what I'm focusing on. I'm focusing on your patient base, and that's where we need to work on first for keeping the business viable during this period. So the first thing is to connect with the patients in one form or another, and I'll explain how. And then also managing the patient recall. I would not be canceling patients. I would be pushing them back, but not canceling, because canceling is disengaging with patients, and you cannot disengage with patients in this environment right now. So
please don't have a list of patients that you're going to call back when you reopen.
By the way, that was a good question. Who has been canceling patients and telling them that you're going to give them a call back once you open up? Can you please let us know? We're really keen to know who's doing that, and also let us know if you are just pushing back the time of when they come in. So you're rescheduling their appointments for when you open up, theoretically when you're opening up. The third stage is connecting with your patients online. There you go. So, and Anne's canceling patients. Okay.
And then, no. We need to push them forward. So we might say, let's book you an appointment in a month's time. And then what happens is, in a month's time, we ring them, we connect with them again, or it might be our staff ring them, and then they push them out another few weeks. So every time we're pushing them out, then it's going to then still keep them in our books. If we cancel them, then we are going to have a much more difficult time getting them to come back in when we reopen.
Much more difficult time. And then so pushing them back is the way to go. So remember that the focus I'm looking at here is that the patient base that I have, I need to protect that. That is most important to the business. The new patients is harder to get, and in this environment, it's going to be much harder. So I might as well just keep what's important for the business, and that is the existing patients. So how do we connect with the patient base that we have? How do we do it effectively to reach them and give them that message that makes them connected to the practice and to the dentist and to the staff? My recommendation is doing a video message, and that is recording a video of yourself and with an iPhone, and just use your iPhone or your normal Samsung phone, whatever phone you have, record a personal message and tell them what you are, where the business is at, where the dentist, how to look after yourself, what the practice is doing, when you potentially will open up, and how they can actually reach you if they have any concerns or urgency. And that's what I'll be doing. And I'll be posting this on YouTube or Vimeo or some sort of media server, and putting a link onto your email or SMS and sending it out to all your patients so they can actually hear you. They just don't see an email with a little letter saying, due to COVID-19, we've shut down the government regulations. That's so impersonal.
Every business is sending an email. So it doesn't stand out. It doesn't stand out. Emmanuel, can I just interrupt for a second?
Sure.
This is an important question that we've got here. Sushil has asked, considering risk factor and cost involved in the treatment, will you suggest single long sitting or multiple short sittings? Single long sitting is the way that we would prefer to go, but it depends on how long the sitting is. You need to change your PPE. Our recommendation is, in Australia, we have to change our masks every hour, and you would also need to keep doing that pre-procedural mouth rinse. I would suggest every hour as well, to make sure that you're keeping the viral load down. But yes, longer sessions and then deep cleaning of the surgery afterwards, letting the aerosol settle, is the way to go. So excellent question. Thank you, Sushil. Thank you.
So doing a personal message to your patients, explaining the situation and how they can reach you. I would let them know that you have available. Now, some of you may not be doing this. We highly recommend it. that you would do video consults for emergency patients where you can't see them. So emergency is where they're concerned about their tooth, or they may need a script, or they just, you know, are concerned in general. It's a way of triaging them as well, but it's also an appointment. So you can do an online consult and charge accordingly, but you're also engaging with the patient. You're not physically touching them and diagnosing them, but it's the next best thing. Tony, do you want to explain a little bit about
I'd really
like consults?
Yeah, for sure. I'd really like to explain this as well, as it can even be part of your screening, okay, of the patients, is that potentially you can be using something like Zoom to be able to speak to your patients and be able to see what's going on with them, especially when you're in the phase of shutdown like you are now. You actually can get access to your patients. And I will say that in Australia, we were doing that when we were completely shut down and we weren't allowed to see any patients. We were doing video consults. Now, what this has done is it has made video consults actually become a methodology, a way of treating patients now. So even though now we can see patients again, video consults are now happening. They are much cheaper for you in your practice, because you don't have to do a complete changeover, and you don't have to wear gloves and a mask. You can actually screen quite a lot of problems over video. I personally ended up helping a lot of people with wisdom teeth issues, so impacted 8s and pericoronitis. You know what you're going to recommend for them. You're going to recommend some mouthwashes and some antibiotics, and then the extraction can be booked later on when we reopen. It's about getting people out of pain. So creativity is really important here, and for one, I love these online consults. If you're not doing them, now is the time to investigate this technology, because I promise you this is the way that dentistry is moving in the future. I wouldn't even say in the future, it's here now. Okay.
Here now. Yeah. So the strategy here is, again, I'm going to go through this 3-cycle path. Okay. It is a pathway of 3 cycles. Video information about what you're doing in the practice, telling patients also in that video message that if they wish to meet up with you or have a video consult, that they let you know via email or SMS. And then what you have is your staff who are at home can call them once you get that information and book them into an appointment, and also take a payment. So that way they're booked in, locked in, and you have the video consult with them. So that is what I recommend in terms of a strategy for your existing patient base. With your recalls, this is a strategy in regards to your recalls. I would be calling the patients. I would get your staff verbally trained. That is, that they have the verbal skills to call and push back those appointments until those practices actually open up. Also screen or triage any patients that have any concerns as well while they're on the phone, and then bring them into the video consults and let them know that you have video consults as well. So this is it again, pushing the video consults. It is the points of communication and connection that is the link with the video consults. So we're trying to really emphasize this with our patients and keep in contact, just to, there's nothing worse for a patient that they feel that they can't see you and they're concerned. And what do they do? If I have a pain, what do I do? Am I going to pull it out myself, or do I need to wait and see a dentist? There are plenty of patients out there that cannot see a dentist and have concerns. This is an opportunity to really use this technology to alleviate concerns, but also potentially reach a lot of other patients who are not seeing anybody at all. So very important. Tony.
Emmanuel, we have a question here from Ashwini saying, online consultation is free of cost, or you charge the patient?
You charge. It's a consult.
It might only be a minor fee, but what I will say is that people were charging in Australia, people were charging patients, and they were able to actually bring some income into the practice while they were completely shut down by offering this service. So please think outside the square and think about what can you do, not just what you can't do at the moment. So yeah, great question. Thank you.
So this is, Tony, as you would agree, this is connecting with the existing patients. This is the patient base that really feeds the practice, has always fed the practice. Even the word of mouth from this database of these patients has fed the practice.
So personally, I believe that patients that are really loyal to the practice, that we would potentially not charge them. Okay, that this is done as a goodwill and building that relationship further. But for new patients of the practice, because you could actually try and attract new patients to the practice, then yes, you absolutely can charge them. You would get them to pay before they have the consultation with you. So that would be an online payment. And yes, we have got a payment gateway coming, that you will actually be able to charge the patient while you set up the consultation as well. So fantastic questions. Thank you very much.
And working backwards a little bit with this strategy, I'm calling it a strategy. Think about the family and friends that these patients are connected to. Why not make it easy by offering this to their family and friends as a choice of actually connecting you with a video consult? Now, what is this doing? We're really emphasizing here on word of mouth, right? And by getting patients to talk to other patients is a way of reaching you still, and you're operating in a sort of semi way, and they're able to connect with you. This is lining these potential prospects into patients when you open up, right? So that's what we're trying to do. We're trying to look after our existing patients, but also trying to get new ones from word of mouth using this strategy. Again, now going online, if I am going online and I'm doing any sort of promotion online, I would be doing it in a slightly different way right now. And I would be just posting that video message that you sent them individually via SMS. I'd be doing that on Facebook or Instagram with the same message, again, inviting people to come for a video consult or inquire for a video consult, and so that your staff can call them and book them in. So this is the strategy I would be doing online at the moment. Where people want to see dentistry at the moment predominantly is for a concern or emergency. The cosmetic market is still there, but not as big as it used to be. I don't think this is the primary thing that we should be looking at the moment. We should be looking at how to really, damage control, prevent damage control from the business, and the patient base is the first thing I'd be protecting, and working backwards with word of mouth is the second thing I'd be doing. But a connection to the patients is really very important in maintaining the practice alive. So with that, this is how we're leaving you today, and we're opening up for questions. And we will answer as many questions as we can for 15 minutes. But if you want lots more of information of what we provide and the training, and even if you wanted some staff training on the systems that you really do need for the practice, or you feel you need for the practice, then we do have this site. Have a look at it. It's not really that expensive at all. It's a little self-promotion, yes, but I really believe in it. There's a lot of very good material that a lot of dentists have been using, and they have transformed their practice, especially in this economic environment. So yes, your view on HCQ as a preventative measure before starting the practice. What's HCQ, Tony?
I'm not quite sure. Sorry, I need a little explanation on that. While we're waiting to get an explanation, if somebody could just let us know what HCQ is, that would be fantastic. Sorry, it's not a term we necessarily use in Australia. Suggest some ways to educate dental staff. Oh, there's so many ways. And I have to say, this is my absolute passion, okay, is training dental teams to provide better services for our patients. So I believe that the patient must be in the forefront of our minds with everything that we do, okay, and that getting our teams to help us provide the best services to those patients is pivotal in creating a successful business. So it may be helping them talk to the patients on the phone, or it may be in helping them helping the patients see value in the treatment that you're providing them and getting them to return for other treatments. Or it might be just in ways that we can teach them to build relationships with the patients. It could be in building your recall systems and making sure that you are providing a great recall system for your patients. So there is so many different things that you could be doing and training your teams. And definitely on that Dental Evolution link that Emmanuel has just given you, we have training sessions on there for lots of different things with our patients. Okay. All right. Hydroxychloroquine.
Is that what it was? Okay.
I will say to you that, yes, there have been some studies that say that that is something good to be using. That's not necessarily, I will say, in Australia, that's not what we have been using. We've been using mouthwash when they come in pre-procedurally, 1% hydrogen peroxide, and that is what we have been suggesting. But you're absolutely right. I've heard that that is a good treatment to be doing as well.
There is a good presentation, you know, on the Facebook group that we're in. It's by you need to watch it. It's probably it's called COVID-19, and it's by a Professor Laurie Walsh, and he is a professor of dentistry and infection control in Australia, and very well respected internationally. And he goes through all of these techniques and procedures one should be using during the COVID-19 situation in terms of mouthwashes, rubber dam, etc. And he does a very good explanation of it. So if you're really interested, you can actually have a look at that as well for additional information.
Excellent point, Emmanuel. Couple of questions here which I'd love to answer. So we've got NASA is asking us, in an emergency case, how can we use our fast handpiece effectively and safely? So as we've mentioned previously, it's all in, first of all, the screening, then the pre-procedural mouth rinse, then the rubber dam is what needs to be done here. Rubber dam, rubber dam, rubber dam. And this is something that Australian dentists said they've never used so much rubber dam before. So what I would suggest is that you look at your stocks of rubber dam, you look at your clamps that you've got, you look at your frames, and you make sure that you've got enough for when you go back to practice, that you keep the environment safe for yourself and your team, because that your health is going to be the health of the business as well. If you catch COVID, you're going to be out of business for quite a while. So this is something that you need to be really considering as well. Thank you, NASA. Emmanuel, I'd love to read out this one. Pranay has written something, and I'm just so thrilled with this. He's written, as what I am practicing is sending an automated message via WhatsApp to first make a payment, digital payment using GPay or PhonePay, and then let the consultation start after payment, and keep two separate payments. Online consultation is $300 and offline is $500. That way they discourage offline consultations. I love your strategy there. Well done. You are a true dental entrepreneur. Awesome. And actually, I'm going to say an Australian saying, beauty, mates. Well done. Don't you think?
Very, very good. Very smart. Very good. Very good. I really like that. Yeah. It's a good tip for everybody here. So yeah, it's very good. I lost my train of thought. I was going to say something I had there, but anyway, we'll go through some more questions until I get it. It's late in the afternoon here. We've had a really full day today.
Yeah.
In emergency cases,
I'd like to know while we're just still answering some questions, have you enjoyed this session? Has this been useful for you? Can you please let us know? Because we would really like to know whether this has been something that you're going to get a few tips from and be able to take back to your practices and help you prepare. So, all right. Thank you. Thank you for letting us know. That's really important for us to know what you need. The more we know what you need, the more that we can give you. So excellent. Thank you.
We'd like to mention a strategy here about how to manage your team when you do open up your practice in this COVID environment. Have you considered a two-team system Okay, so Tony, do you want to explain a little bit about the concept that we came up with, the two-team system here?
Absolutely. So what we have come up with is the fact that if you've got two dental clinicians, so if you have two dentists, the safest way of opening up your practice and ensuring that you're going to stay open is that you would break your team into two. So you would have one dentist and assistants, so in one team, and another dentist and their assistants in another team. And you would swap the teams. So let's say Monday, Wednesday, Friday would be team one and on 1 week, and Tuesday, Thursday would be team two in that 1 week. Then you would swap the following week. Now, the reason that we're suggesting two teams is because if one of you becomes COVID positive, or if you've had a patient that is COVID positive and then you have to shut down the practice, if everybody is working all at the same time, then you're going to have to shut down the whole business. Now, if we've got two teams, then one team that might have to shut and close down and go away and be in isolation, the other team can still keep going. And that way we're still going to keep cash flow coming through. Emmanuel, thank you so much for mentioning that. I'm glad that you reminded me to bring that up. So fantastic.
Yeah, it's worked very well, that concept, but it's also ensuring that the practice, again, I've got to remind everyone that the focus needs to be on the practice. And so the team and the whole practice needs to remain viable. So you need to strategize, and this is part of the strategy here, is that when you do go back into business and you open up, what are the precautions that you can ensure, not only the patients and your team, but how you ensure the practice really, survives should something happen within the practice, and you need to really look at all of your bases. And this is one of them, is to really separate the teams. If you've got a big team and you're not enough patients, then this is probably a really good way, is to manage the team in two, and make sure that you have your scheduling accordingly that fits to the two-team system. But, once, say, for example, that team is off for the week, you make them work from home. They could still be doing admin and bookings and calling up patients, and the dentist that's the associate could also be doing online consults in that week. So that's how I would be managing the business while you're in partial shutdown, or while it's still not kicking along at full capacity.
We have somebody here, Shavari. I'm sorry, guys, my Indian is not good. It's non-existent. So thank you for understanding how I'm pronouncing your names. Has written, I suggest two teams. One team continues working continuously for 15 days, then take quarantine for next 15 days. It avoids all possible risk. Look, I think that however you do it, 15 days sounds interesting. I'm not quite sure how you came up with the 15 days.
A 2-week incubation period for the COVID-19 before it shows any symptoms.
So that's the microbiologist there, talking. Fantastic. So that's wonderful. What I want you to remember, guys, is this information that we're giving you is what the top practices will take on board. So, some of those big chain companies that you've got that are offering dentistry, and they've got a number of practices located throughout your city or a number of cities. These are the sorts of strategies that they will be using. So to keep yourselves competitive in an environment where there's going to be fewer patients, these are the sorts of things that you need to start thinking about. So, I'm really glad that you've enjoyed it, because that's something that I believe you need to start using to move ahead.
I have another question, Tony, that some people may or maybe not be thinking about is, in India, from what I understand, there's a little bit of a different system of how they pay their staff and how we pay our staff when we're closed down at the moment. So we've got government assistance here in Australia, where the government gives a certain amount of money to keep the staff on board, so we don't get rid of the staff, right? So
quite fortunate, aren't we?
Sorry, we are quite fortunate. So the government here in Australia is giving us, paying us a wage, a portion of the wage, and they're also paying a portion of the wages of our staff. So we're kind of very lucky in some ways, considering the situation. We're kind of very lucky here in that respect. But in India, you don't have that luxury. You have to pay them, from what I understand, while you're in shutdown and you don't have production. So this is really going to put a lot of stress and strain on your finances doing this. Now, what can one do in this situation? And I know, and I understand why you're doing that is because you're really concerned about losing your staff, especially, if you've had them around for such a long time and they've, been loyal to you and you're loyal to them. So there's a loyalty factor, as well as that it's also difficult to get very good staff. And so you don't want to lose them. I have a few answers to those. Toni, what would you like to say on that?
Firstly, I'd like to say that yes, money is a very important part of your team satisfaction. So, of course, they are coming to work because they want money. All right. But studies show, and this is well known around the world, that money is only one factor that helps keep staff happy. Staff love having a team to work with. They love working in an efficient, well-organised business, and they actually really love and appreciate when you are able to develop them personally and professionally. So I believe that we have room here to negotiate with our teams where we are able to maybe give them some extra training, help them build their skills, but maybe then ask them to cut their wage down a little bit to help you be able to keep the business going. It's so much better for them to have a business to keep going to and have a job to keep going to, rather than in a couple of months the practice has to close. So I believe that there are some negotiations that you can have. If you are a good leader, and if you strategize well and you have got great plans that you can communicate this well with your team, this is very much a possibility. Now,
totally agree, Toni. Yes, you were going to say something else?
No, that's okay.
Totally agree. Now in a different scenario, if you have a staff member that doesn't really understand this, and you're communicating this, then what it comes down to, and this is what I have to say about this, is that it comes down to everything is for the good of the business. Okay, so you need to take your emotional aspect out of this in terms of, I know that there are an emotional connection to the staff, and I totally understand this, but what it comes down to when you put your business hat on, remember how Toni said you've got to take off your dental hat off and put your business hat on? Now you've got to put your business hat on. Everything rides on the survival of the business. So your business comes number one. So if you are at a potential risk where you are going to lose so much money that you cannot kickstart the business, then you have to make a serious decision of whether you are going to let go of some of your staff members. And, just take it by chance that you will get them back in one form or another when you start up. But you must protect the business first. If you don't have a business, you won't be able to employ staff and you won't be able to service patients and you won't have a livelihood. So please remember that in this situation, you're going to be tested to have that business hat on, and you need to implement it during this time, that your business hat must come on and you must take the dental one off, and you need to make harsh decisions for the survival of your business. And that's, I guess, the message that we're going to potentially leave you with, and we'll answer just a couple more questions for you.
I would like to say thank you so much for having us. We have really enjoyed presenting to you today, and we really do wish you the very best with facing everything that you're facing during these challenging times. And we just hope that you've picked up one or two things that might help you. So thank you very much. While we're just waiting for the last few questions, Emmanuel, anything else you'd like to say at the moment?
If you want to hear more, we would be more than happy to come back and give you lots more. We've got so much material, but this is some of the short tips that we can give you in this hour and a half for today. I hope some of this realigns your thoughts and gets you in the right direction. You know, it's confusing at this stage. There is a lot of emotional confusion as to what one should do. No, not many people have ever faced, I don't think anyone's ever faced anything like this. Sure, we've all faced hardship during the dental environment, you know, in the previous years. And it's been very difficult to operate a dental practice in the last few years. But this is really the big wave that's taking out a few people. There are going to be practices that are going to shut down out of this. And there are those that are going to survive. And whoever survive has a lot to do with how they're strategizing now and how they're going to kick back in when the environment starts to change and how they're going to adapt in that environment. And that requires you to start thinking more business-like than dental-like. And you need to really bring those instincts in. This is where it's needed. So I wish you all the luck. If you ever need any help, let us know. We are, you know, we're around. You can reach us on the Facebook we're at, or messenger us at our messenger, and we'll try and help you as best as possible. Obviously, we can't help everyone. There's a big population of dentists out there, but we'll try our best.
Yeah. Thank you, everyone, and really appreciate all your lovely comments and questions as well. Thank you very much. Take care.
Wonderful. Thanks.
Bye.